The World Health Organization declared the monkeypox outbreak is no longer a global health emergency, unlike it was since July 2022. It was an extraordinary event that constitutes a global public health risk through the international spread of disease and to potentially require a coordinated international response. A public health emergency of international concern (PHEIC) creates an agreement between countries to abide by WHO's recommendations for managing the emergency. Each country in turn declares its own public health emergency that carry legal weight. Countries use them to organize resources and abandon rules in order to ease a crisis. After a heated meeting this week, WHO's Emergency Committee for Mpox recommended an end to the emergency. It met and recommended that the multi-country outbreak of Mpox no longer represents a public health emergency of international concern. Mpox continues to pose significant public health challenges that need a robust, proactive and sustainable response. Countries are urged to maintain their testing capacity and ability to respond to future outbreaks quickly. Globally, cases have been declining for months, especially as awareness has increased and the vaccine became more widely available. There were 90% fewer cases reported over the last 3 months compared to the previous 90 days. There is understandable uncertainty about the probability of a large resurgence of infection. There are also gaps in knowledge about modes of transmission in some countries, as well as the effectiveness of vaccines and continued lack of effective countermeasures, particularly in African countries where transmission and Mpox cases occur regularly. As a result, WHO's expert committee determined that the challenges were best solved through a long-term approach rather than through emergency measures. Mpox is a less severe cousin of the now eradicated smallpox virus. It's endemic to parts of West and Central Africa and has typically been contracted from a rodent or small mammal. After a dramatic drop in cases in recent months, monkeypox is no longer designated as an extraordinary situation that qualified as a global crisis. We now notice steady progress in controlling the outbreak based on the lessons of HIV and working closely with the most affected communities.